Welcome back to Beyond Just Condoms, a series covering all the different ways you can prevent sexually transmitted infections. Today, we are discussing the correlation between STIs and substance use. For many years, injection drug use has been associated with the transmission of hepatitis B and C, or HIV, when needles, syringes, or other injection equipment is shared or reused. This is because the needles, syringes, or works may have blood in them, and blood can carry these viruses. That's why you should avoid sharing needles, syringes, or works for injecting silicone, hormones, or steroids as well. But using any substance, whether you are drinking, smoking, snorting, or boofing, can facilitate situations where you may be exposed to STIs. Researchers have found that as substance use frequency increases, the likelihood of sex and number of sex partners also increases. Some people might use or combine multiple substances to shift boundaries, delay orgasm, intensify sex, extend sexual encounters for hours or days, or reduce sexual inhibition. This is sometimes called chemsex. But when using substances with sex, protective actions like getting and giving consent, wearing condoms, using lube, and discussing STI history and testing among partners may be easily disregarded. Altogether, this leaves people who use substances during sex vulnerable to getting or giving STIs. Along with impacting your behavior, some drugs can cause injuries or changes in your body that make getting STIs more likely. For example, one common party drug, poppers, is often associated with sex. Poppers relax smooth muscles in the body, including those found in the anus and vagina, which can make anal and vaginal sex more pleasurable. Poppers are vasodilators, which widen blood vessels and increase the blood flow to the genitals and anus. As the muscles become more relaxed, it can increase the potential for tears and cuts, which increases exposure to sexual fluids and blood. It's best to avoid using substances so you can keep a clear head and stay consistent with your safe sex practices. If you do want to or plan to use substances as a part of your sex life, make sure you have a plan in place to keep you safer. Stay well hydrated, take breaks, and have snacks around to maintain healthy energy levels. Avoid sharing or reusing equipment used for substances. Have someone you trust there to look out for you and keep you safe. Decide for yourself how much you use or take, and don't leave it to someone else. It's best to agree with partners in advance and while sober what sex and substances you do and don't want to have, so everyone is in agreement and has their boundaries respected. Before you go out, talk to us or your healthcare provider about PrEP and DoxyPEP. They can add protection before or after the party's over. If you have questions about your sexual health, call and schedule an appointment at the health department. We're here to help. Have fun, be safe, be healthy.